Hello, my name is Grebe. I'm a researcher from Professor Anne Dörte-Lattek's Intellectual Disability Nursing Research Group at Bielefeld University of Applied Sciences in Germany. This presentation is about an advanced practice nursing approach on medication management in the field of people with intellectual disability. People with intellectual disabilities have several health-related conditions that occur more often than in the general population. They have difficulties in independently taking their medication, which is even more challenging the more the medication regimen gets complex. Health literacy with regard to medication, for example, the effects, side effects, dosage, dosing frequency of the medication, is actually a challenging task for the general population and even more for people with ID. The often complex medication regimens have a higher risk for side effects and interactions, and aside of the medication, people with ID also participate less in preventive medical checkups such as colon cancer, prostate cancer, gynecological checkups compared to the average population. So our objectives within this research project are to ensure that people with intellectual disabilities have, understand, and adherently follow a multi-professionally coordinated medication plan that should be integrated into their individual daily routine to promote medication adherence. Also, we want to reduce the complexity of the medication regimen where appropriate, which not only refers to the number of prescribed medications, but also the number of times to take the medication over the day, and tasks like splitting or crushing pills. Medication adherence should be improved, and where appropriate, psychotropic drugs should be reduced, and finally, the participation in medical checkups should increase. The intervention I'm talking about is an advanced practice nursing intervention that comprises home visits to the client, typically 2 of them, and in between these home visits, continuous contact via telephone or, where appropriate, email. The APNs can optionally use case conferences with an external multi-professional team at a medical center consisting of physicians out of different disciplines and a pharmacist, and also optional is a case review of the medication with the prescribing physicians of the client. If we look at the intervention, we have a triangle with a person with intellectual disability, the APN, and the caregiver or caregivers, which can be, for example, a professional personal assistant or the legal guardian, or also quite typical, the relatives or parents of the person with ID. So the intervention starts with an assessment and reflection of the health and social status of the client, the components of the medication management, and the needs and the history of medical checkups. The current medication is reviewed by the APN, who checks for the side effects, interactions, and of necessity of the prescribed medication. And as I said before, the APN can initiate a case conference here to get optional support from the external multi-professional team, if the person with ID agrees with that, of course. In most cases, the APN has the recent medication plan, which is to that point not validated, but she has it already before the first home visit, so parts of the review can be done in advance. The APN uses patient education and counseling to work with the person with ID and the caregivers with the objective to improve medication-related health literacy with regard to the individual health conditions to improve medical adherence. Finally, there's shared decision-making on how to proceed. Working on a change of the prescriptions can be a result of that, but also changing the handling of the medications or changes in the communication between the caregiver and the person with intellectual disability. If the change of the recent prescriptions is intended and or a medical checkup is needed, this leads to a contact with the prescribing physicians, and this can involve the APN directly so that she goes into a dialogue with the prescribing physicians. If it is intended that the person with ID and or the caregivers go into the dialogue with the physicians by themselves, the APN prepares that visit and trains them. The evaluation of this project comprises several modules with a randomized controlled trial with 2 groups and a pre-post design, with medication adherence as the primary outcome and quality of life, the health status, complexity of the medication regimen, use of psychotropics, and the participation in medical checkups as secondary outcomes. This trial is registered in the German Register of Clinical Trials. We also have a cross-sectional survey that addresses the control group, which is a waiting group that gets the intervention after 3 months of intervention-free time period. And this addresses the experiences with the intervention. We conduct 30 to 40 qualitative interviews with the stakeholders, which addresses all relevant stakeholder groups, the physicians, the APNs, the people with ID, the legal guardians, the caregivers. One special thing that we also have in the evaluation design is an inclusive research approach that involves people with ID as co-researchers. We report on this approach in a parallel session on this conference. Some preliminary results of the evaluation. I cannot tell you any results of the RCT because it's blinded to data analysis, but from the first 36 cases of the control group, we can say that according to what the people with ID say, that 96% were satisfied with the work of the APN and 74% find it to some amount easier to talk to physicians after the intervention. According to what the caregivers say, the APNs gave advice to change the medication in more than any second case, and they say medical care improved in 32% of the cases and cooperation with physicians in 23% of the cases. 20% of the caregivers stated improvements of the client's competencies with regard to medical checkups and with regard to medication, and also 20% stated improvements in the client's communication behavior with regard to health questions. In the interviews, all stakeholder group emphasized the value of the intervention for the target group, and professionals as well as relatives and people with ID themselves state that the transparency according to medication and medical care has strongly improved. Thank you very much for your attention.